Hi everyone, I'm Corinna from plainspeakinganatomy.com, a blog designed to support students and practitioners in learning about veterinary anatomy. I wanted to let you know that after a bit of a break, I'm back in the online veterinary anatomy space with a series of videos about applied anatomy called Veterinary Anatomy in Practice. In this series, I'll be talking to vets in general practice, specialist vets, nurses, and others about the role that anatomy plays in their everyday working lives. I'll also be getting their advice for students about how to make the most of anatomy class to help prepare for clinical practice. The key theme I'd like to explore is that anatomy is your friend. Often it might seem like your enemy, especially around exam time. And believe me, I do know that feeling. But the good news is that firstly, anatomy can be fun and extremely rewarding. You might have to trust me on that for the moment, but I'm hoping to convince you that it's true. And in that spirit, I've created a bit of an anatomy lounge to hopefully show that while anatomy can certainly be a detail-heavy subject, as you can see here from the library, talking about anatomy can also be a warm and friendly experience and can really improve your confidence around this fascinating yet sometimes intimidating subject. The second bit of good news is that obviously anatomy helps to make you a competent vet or vet nurse. And there are many reasons for that. Some of them are very practical. For example, how to find a vein, how to pass an ET tube, where to place a stethoscope, where to make a surgical incision. And of course, all of these are really important. But there's another really important thing, and that is that anatomy helps you to recognize what is normal, and therefore, by extension, to identify when something is not normal. Veterinary patients are many and varied. Even if you just decide to work with dogs and cats, there's a huge amount of variation in the patients that you will see. Differences in size, proportion, eye color, ear conformation, nasal morphology, chest depth, posture, and gait. The list just goes on. And that's just looking and feeling from the outside. The journey continues with diagnostic imaging and other investigative procedures, including the neurological exam, where an understanding of the hidden internal anatomy is crucial for interpreting your clinical findings. The more you know what to expect, the better you'll be able to recognize when something is or could be amiss, and whether you could or should check something else to help understand what you're seeing. I'd also like to explore the age-old question of how much is enough detail. In anatomy class, we're confronted with an avalanche of terms, structures, branches of vessels and nerves. How much can one human database hold? For how long and for what purpose? Of course, there's no definitive answer to this question. There will be as many veterinary anatomy curricula as there are training institutions, and each will have a slightly different take on what's important for day one graduates. And of course, no one is right or wrong. What these programs are trying to do is to give insight into the staggering complexity of anatomy and put some kind of logical, meaningful framework around that. They're also trying to help us get our heads around the anatomical relationship between one structure and another, and why this matters in terms of function, both normal and abnormal. And on a very practical level, when we're talking to colleagues in general and specialist practice, this anatomical background helps us to communicate without confusion, which in turn makes communication more effective and efficient, which helps to avoid mistakes and could ultimately lead to improved patient outcomes. To put all this another way, studying anatomy in detail gives us an anatomical vocabulary, a strong grounding in practical anatomy, and importantly, the skills to go and seek out further information that we might need in a given situation. But that's just my take on it. I'll also be getting the perspectives of others who've been there and done that and will have reflections of their own. What I'd really love is for you to just sink into anatomy a little bit in a relaxed but informative way, and hopefully take away some insights that will help you in your studies and your career. You can see the videos on my blog, or you can subscribe to my channel and see them there and get notifications when new ones become available. I look forward to seeing you in the lounge.